You ever heard of restless leg syndrome? I've seen a few patients with it over the years. A YouTube subscriber emailed the other day about her symptoms. I wanted to look into it in a bit more detail. Keep watching and I'll tell you all about it. What is restless leg syndrome? Well, it's a neurological disorder that causes uncomfortable sensations in the legs, often accompanied by an irresistible urge to move them. These sensations are typically described as burning, itching or tingling, and they're usually worse at night or during periods when you're resting. It can be absolutely maddening, particularly at night, because it stops you going to sleep and it keeps waking you up. Now, nearly a third of the general population will complain of symptoms that are like restless leg syndrome, but probably fewer than half of them will actually have the formal diagnosis. It can also affect other parts of the body, including the arms. Some people say that their symptoms started after hip replacement surgery or is made worse by it. While the exact cause isn't really clear, factors like surgical trauma, changes in medication or inactivity will all play a role. Surgery causes a massive inflammatory response that can make nerves more excitable, so perhaps this might be a part of it, particularly if you've had symptoms before surgery. So how do we manage restless leg syndrome after hip surgery? We'll start with the simple things like avoiding alcohol and caffeine. These can affect your sleep and this makes restlessness even worse. Drug treatments can include things like dopamine antagonists, anticonvulsants and diazepam, which is a muscle relaxant. Some people benefit from electrical stimulation with a TENS machine or even acupuncture. Physiotherapy, yoga and Pilates are really helpful in the longer term management of this condition, but they're also good ways of getting fit and recovering from your hip surgery. In my experience, most people who have restless legs after hip surgery usually get better, but it can take several months. If it persists, then let your surgeon know. You might well be referred to an experienced neurologist for a formal diagnosis so that the right treatment is prescribed for you. It's always better to know what's happening so that you can make informed decisions about your health and well-being. Well, I hope you found that interesting. Restless legs is an absolute curse for the people who have it. If you want to know more about restless legs or anything about hip surgery in general, then please get in touch. The details are in the description below. Thanks for watching. I'll see you all again next time.